Ryan VanHolsbeke is the director of FP&A at Midwest Express Clinic, where he leads financial planning and performance management across 50-plus urgent care locations. With more than 20 years of experience in cross-functional finance roles, he brings deep expertise in budgeting, forecasting, and pricing to support the highest stake decisions at Midwest Express. Welcome to DX the podcast, Ryan.
Well, thank you for having me.
Yes, it's been great to get to know you a little bit more as I've kind of entered into this urgent care space. So
I would kind of say the same thing, though, as I've entered in. I mean, I've spent a little over 2.5 years in the urgent care space, so I'm learning every day and meeting new people and forming relationships. So it's been great.
It's a great space to be in.
Absolutely.
Well, it's also great to be here with you in Chicago, which is right at the center of the city that Midwest Express Clinic serves day in and day out. And just to set the stage, Chicago is the third largest city in the U.S., nearly 2.7 million people. The metro area is the third largest economy, generating roughly $700 billion in GDP each year. And this scale creates a dense, highly active market with strong demand for healthcare, as you well know, being within Midwest Express. So let's start there. How would you describe the healthcare landscape in Chicago, and what are some common misconceptions from those maybe on the outside looking in as they think about Chicago?
Yeah, I think we've got a strong hospital system. Many teaching institutions ranked in the top 10 in the country.
Oh, yeah.
But I think as you start to think about those, accessibility becomes a big issue. Just getting into, I'll let them remain nameless, so to protect the innocent. But just to make an appointment to see your PCP, you're looking at 6 to 8 months. And the insurance landscape for providers, physicians, isn't great. So we see a lot of exit from the market. And so when my PCP exits the market, what happens? I become a new patient. And I start the clock over, every time. And so what used to be, hey, you can get in a little bit shorter period of time, and certainly not today, tomorrow, or the next day. But it really, I think the accessibility to healthcare, while we have a lot of options and a lot of great institutions, can be difficult.
Yeah, I mean, you think of Chicago as this big healthcare city, like you mentioned, multiple institutions, a lot of training facilities, but really in a lot of ways it can be a healthcare desert for many of the patients in the community.
Absolutely, and the accessibility in different communities. And so you start to think about that, and what role can urgent care play into that, I'll call it a healthcare desert, maybe, right? And when we think about accessibility, reliability, so always open. Someone there, lights are on, extended hours. Many people, if you think that they work an 8 to 5, Monday through Friday.
Those are the hours they're working.
Those are the hours that the physician is working as well. And so being able to see what you could kind of deem as your PCP, a primary care, in those hours becomes very difficult. So you start thinking about socioeconomic status and where people are. And it may be tough for people to take 4 or 5 hours off of work to go see and get the care that they truly need. So having that availability, being open on Saturday and Sunday, that plays to to those Monday through Friday and people who work kind of standard hours.
For sure. So we think about that. That density of healthcare organizations doesn't necessarily mean density of healthcare access. So very, very interesting. So when we think about these kind of healthcare deserts, and especially in the Chicagoland area, talk about how Midwest is positioning yourself as not just an immediate care, but really, or urgent care, et cetera, but really a longer term solution, and kind of walking us through how do you communicate that to patients, or what strategies are you using to drive repeat visits, this kind of loyalty perspective, and even awareness around that longitudinal care.
I think if you just the word urgent care can often have a negative connotation. You start
any word for that matter. There's over time.
Absolutely. And I think there's a perception that it is treat and street, doc in a box, really only providing kind of care for that one particular instance, that singular point in time. And what we've started to think about is what's more of a long-term relationship we can build with those patients. Simple things. You come in, you feel a little under the weather. So typically you run through a URI kind of protocol. But you ask a simple question. When's the last time you've had a general wellness exam? Just something that you've put in the front end of your kind of talk track. Right? And that gets people thinking, I haven't seen a doctor in a while. Why are you asking? And very simply, because we can do that. We can perform that. We can provide that service for you. And so it really is being there for people, for more than just that one singular instance, and educating people around that so that they can get the care they need. I mean, we've got our tagline is healthcare with heart, right? And so some people may say that's kind of cheesy, but reality is that's what we're doing. We're really thinking about that patient for more than just that episodic care. It's how can we be there for people in communities where there are less access to healthcare. And healthcare is really important for everybody.
Absolutely.
Right?
Yeah. We're all patients.
That's right.
At the end of the day. Yeah. We've talked a little bit about this before. And one of the things that really stuck with me is how often you as Midwest Express as an organization are asked the question about, do you accept, more than just commercial insurance? And so that naturally brings the conversation to Medicare and Medicaid, which is something that not all urgent cares accept and work with. So how do these kind of reimbursement dynamics factor into your broader strategy and vision for the business of Midwest?
Yeah, absolutely. And as we think about clinics that may not be in as an affluent area where we're going to see a little bit of a higher mix of that Medicare or Medicaid, we know going in that it's going to be a little bit tougher sledding from a financial standpoint, profitability standpoint, but you can still earn and make money and be profitable at those levels. You actually, I mean, not to use the auto industry, the old, we'll just make it up on volume, but there is a volume component there. There's an aspect of that. So we look at it and we actually spend a lot of time trying to find insurances we don't take to try to continue to broaden that spectrum to the accessibility. So people look and say, well, I only want to take commercial insurance. If you look at the other types of programs that are out there, you can make money.
Yeah, you might be missing the boat a little bit.
Absolutely. Right. And if you think about you're not going to see 100% from that. There will be a mix. It may skew a little bit towards that, but it's not enough that you can't afford to continue to provide care. So,
and you get to continue to resonate your name within the community and bring that perspective to the table that you really are that care with heart,
That absolutely is. And if we think about our patient base, you can spend a lot of money on marketing and everything, right? But the cheapest, best marketing is word of mouth.
Absolutely.
And somebody comes back, somebody goes to has a great experience.
They're going to talk to their family.
They're going to talk to their
friends.
That's exactly it. Particularly in some very tight-knit communities where they may not trust a large hospital system or something, right? And so you start to think about that. And Ryan had a good experience, told his brother, his sister, whoever, and you really start to build some of that where we'll see, entire families come and really come in. 5 people show up at a singular instance. But then they tell you, oh, my brother told me to come, right? So you start to build.
That's interesting because the ripple effect goes both ways. So you mentioned there might be negative connotation with certain past experiences with other organizations, but then on the flip side, how can we kind of pivot that to a beneficial, positive experience and let that ripple effect take hold?
Yeah, I mean, you only kind of get that first chance, and when we can be there to kind of pick up where somebody left off, that's fantastic for us, and we want to keep people coming back.
Yeah, for sure. All right. Well, we've talked a little bit about disparities kind of within communities and socioeconomic status. And really, it's pretty stark in the Chicagoland area. So there's affluent communities, less affluent communities. How does Midwest actually see the kind of disparate community approaches? How do you see that as actually an opportunity as opposed to a challenge? And you kind of touched on this a little bit, but I know that it's really at the heart of the operational kind of mindset as a leadership team. And we've kind of talked about that previously. But really, it's kind of an opportunity to evolve faster in this rapidly changing industry. So talk me through kind of affluent, non-affluent, identifying your market, that sort of thing.
Yeah, so as we think about where are we going next, right? It's always a question on our mind. What's the next spot? Where are we going?
Sure.
And you start to look, and we've saturated a lot of areas. But then you simply just pull up a good old Google Maps, and you start to look for some of these healthcare deserts. And you can do a little bit of data research and figure out what the market is in the pieces. And so, for us, being in the community is really important. When we say we're part of the community, we come in. We're not just a business in the community. We're part of that community. We do outreach. We open our doors. We spend time in the community. We meet with the aldermen, everything. Because really, just here's why we're here. Here's what we provide. and really become kind of ingrained in that community. We want to be part of that piece of it.
Yeah, and really give back, it sounds like.
Absolutely.
Really
Again,
special.
I mean, we touched on a little earlier about the importance of healthcare in any community. Right? And if you can come in and be that piece and do that for people, that's communities tend to love you a little bit, or at least like you.
And extremely fulfilling on your end as far as what you're able to bring.
Absolutely, right? We all do this. I mean, we do have to make money. I mean, let's not.
Yeah, you need to be able to turn the lights on, open the doors, all the things.
Continue to provide care for patients.
Yes.
But there is a good, where you feel good about that piece of it, that you were able to fill that void for someone.
Yeah.
And you may or may not, it may be something just small, episodic.
Yeah.
But then they come back and you diagnose something for them that really can be a life-changing experience for them.
Longitudinal story.
That's exactly it. And it may not be something, but how about diabetes management or something, right? Like you help them, you set up a program, a plan. You can keep kind of doing the follow-up visit, have them come back, monitor their blood sugar and everything, and really get them on a path to healthy, right? And so you think about that individual.
It's a changed life.
It absolutely is. It absolutely is. They're not rushing to the emergency room because of something. They've got a plan. We'll execute on it together. You build a little bit of trust, and they want to see you.
Love it.
Yeah.
Well, it was great talking with you, hearing a little bit more about the heart behind Midwest Express. So look forward to next time, and we'll chat more in the future, I'm sure.
I appreciate the time. Thank you very much.
Great.